Hello, party poopers! It is the IBS Freedom Podcast, and once again, I am joined by the wonderful, the beautiful Amy.
Hello. I feel like these have been especially sweet lately.
Well,
Maybe
I'm smitten. What can I say?
Oh,
You're my favorite pod person.
Aw.
Side note, for Halloween, next year, can we be pod people together, and then we can, make Instagram reels together? I feel like that could be a pretty amazing Halloween opportunity. We would have to envision, what our version of pod people would look like, but I think that could be a fun one, since I call you my pod person.
Yeah, for sure.
But,
I'm down.
per the usual, the good folks at home already read the topic for today when they clicked on this episode, but care to reveal anyhow?
We're talking about diarrhea today.
Diarrhea. So this is the yin to the yang of our previous conversation around constipation. So now we're going to do better, Amy. You ready for this? Let's talk about what the definition of diarrhea is, because it took us 42 minutes into the constipation episode to reveal the definition for our good people at home. So how would you define diarrhea? If somebody, some alien off the streets came in and was like, what is diarrhea? Why should I listen to this episode? What would you tell that alien who apparently doesn't poop?
Well, I think that there's sometimes a frequency component. There's sometimes, and I think more often than not, I think of diarrhea as being a consistency problem. So having loose stools often where things aren't formed properly. If you go to the Bristol stool chart, that's an easy one to kind of look up. If you're in the 6 to 7, it's definitely, I would say, diarrhea. Or problematic. Even 5's kind of borderline there. But if you're having loose stools regularly, every day, that's kind of problematic. I think for some people there's urgency involved, where they're kind of rushing to the bathroom.
Yeah.
Some people have high frequency, so they're going, more than 3 or 4 times a day. And it's looser on the looser end. Those would be the main things that I would say that stick out to me. It's kind of the urgency, sometimes higher frequency, but when I really think of diarrhea, I think of the consistency not being quite right. Do you have anything to add to that?
Yeah, that's about what I was going to say too. I think that the consistency is probably the number one that we look for. Is it watery, like Bristol stool type 7? Is it a mushy blob of chocolate pudding and it has no form and it just kind of disintegrates when it hits the bowl, but maybe when it left your body it had slightly more form to it than a type 7 would? Or is it loose blobs that maintain some degree of form in the toilet but not a heck of a lot? I think that the consistency is going to be the big one. Followed by, yes, I think if you're pooping more than 3 times a day, I feel like 1, 2, or 3 bowel movements a day is pretty normal. And then if you start getting into the 4+ per day range, then I'd be thinking that that's atypical. Now, somebody could be constipated and have little marbly rabbit pellet turds, and they could be excreting 1 little rabbit pellet every time they poop, and they could be pooping 4 or 5 times a day and be constipated.
Right.
But I think certainly if you have looser stools and you're going more frequently, or if you just have looser stools and it's not necessarily a frequency issue, or if you're finding that you have to run to the bathroom because you might not be able to hold it, that's more of what I would classify as diarrhea as well. And of course, like constipation, there's a lot of different causes, right? So you want to maybe start off kind of mirroring the pattern from our last episode. Let's talk about microbial reasons why somebody could have diarrhea as a starting point.
Yeah. Well, again, I think of SIBO. I think probably everyone that listens to our podcast could think of SIBO as a microbial component. I also think typically the gut pathogens are much more diarrhea promotive, just because they're so inflammatory. So if you have some sort of gut pathogen, or you had food poisoning or a gut infection, that's going to be more diarrhea predominant. at least at first, again, when it's acutely present. So I think that those are big. Probably if you have an overgrowth, even if you don't have SIBO, but you have too much bad bugs in your colon or dysbiosis, that could lead to diarrhea. But those would probably be the biggies. And it probably not having enough good bugs to talk about balance. But that's sort of, I guess, similar to dysbiosis, like having an imbalance of good to bad. Those would probably be the biggest ones that I can think of. Kind of infections, SIBO, and dysbiosis in general. I'm trying to think if there's any other particular things, microbial, that I could think of.
I would say parasitic infections lean a bit more towards diarrhea typically.
Right.
You can have a parasite be constipated. I'm not saying that's impossible, but I think that the likelihood of a parasitic infection is higher with diarrhea. And you'd be surprised too. I don't know if you've seen this much, but I have had people come back with confirmed cases of Giardia on like LabCorp stool test, not even a GI map, like LabCorp stool testing showed Giardia. I remember this woman had, they labeled it IBS, and she had chronic bloating and diarrhea, and she didn't know why, and we did some stool testing right out the get-go, came back with a case of Giardia. She had no idea how she got it. She was like, I go nowhere. She was like, I stay in Raleigh, and I walk down the road to the dog park with my 2 golden retrievers, and then I go home. And that's the only thing I do. This was pre-COVID even. And she's like, I don't leave the house. Like, I don't know where I got Giardia. But treating it made her feel a heck of a lot better.
Right.
So, parasites are always on the table, particularly with diarrhea. And I think, to your point, I think so much of the microbial conversation is a spectrum where, like, on the far, far, far end, we have things that are bad all the time in any quantity. So, like, Giardia. If you have a little bit of Giardia, that's worthy of your attention and concern, right? Like, there's no normal amount of Giardia in the human GI tract. Similarly, like, things like Campylobacter, Shigella, cholera, like some of these real nasty nasties, they are always abnormal in any quantity. You find that, you treat it ASAP. Then, a little bit shy of that, you have the things that are pathobionts, which are, like, they're bad, but they're not so bad. So these would be things like E. coli, like your run-of-the-mill E. coli, not necessarily like the enterotoxigenic and the Shigella-like. Like, I'm talking like page 2 of the GI map for those of you who know that test. But like E. coli, Klebsiella, Pseudomonas, Staphylococcus, Streptococcus, stuff like that like you don't want a lot of it. Yeah, Morganella. You don't want a lot of it, but if you see like a teeny tiny amount of that coming back as a commensal on your stool test, that's not necessarily cause for concern.
Right.
And then there's like the medium guys who don't really do anything particularly good or particularly bad. They're just kind of hanging out. So I'm picturing like the Bacteroidetes group, for example. They're not the best. They're not the worst. They're kind of in between, hanging out. And then you've got on the other far end of the spectrum, you have the good guys. So these are like your lactobacilli, your bifidobacterium, Akkermansia, Faecalibacterium, Eubacterium, Roseburia, stuff like that are like producing some good compound for you and doing you a lot of favors. So the far end of the spectrum, like the overt pathogens like Giardia, high likelihood of causing diarrhea when they are present. The pathobionts, like the Klebsiella, E. coli, Pseudomonas, Morganella kind of crowd, I would still say they're leaning more towards causing diarrhea rather than constipation for most people, but not always. The medium guys I wouldn't sweat too much in this context. And then the deficiency of those good guys, like not having enough of the short-chain fatty acids or, things like lactic acid, or, the compounds that your good bacteria make for you. I think a lack of those good guys can also definitely cause diarrhea for people.
Yeah, and I think some of this stuff can be compounded or even like stand alone if the immune system isn't functioning super great in the gut environment. Again, let's say you have a vitamin A or vitamin D deficiency or deficiency in some of these immune-based compounds where like inflammation isn't being controlled. Like I think inflammation, especially like where it's kind of showing up on a test. I mean, obviously the most clear depiction of this would be some of the IBDs. But I think that, if there's uncontrolled inflammation at the gut lining, whether it's being caused by pathogens of some sort or dysbiosis of some sort, or from some other causes or compounding factors of some of the dysbiosis, it can be something to consider too. Like, how is the immune system functioning at the gut lining? How are you controlling inflammation at the gut lining? Because that could help a lot with inflammation and help with some of the diarrhea.
And I don't know if this segue was intentional on your part. If it was, bravo to you.
I don't think it was. I didn't have an agenda.
Okay, well, I'm going to give you credit anyway. Let's segue into mast cell stuff. Because, again, like, nothing is clear-cut in this world. Like, for example, there are people, just briefly to go back to the previous point, there are people with methane overproduction who have diarrhea. Yeah. And there are people with hydrogen sulfide overproduction who have diarrhea or constipation. There are people with hydrogen SIBO who have constipation. So, like, there's general kind of patterns that we're going to point out in these episodes, but nothing is a hard, fast, 100% of the time rule. So keep that in mind. But one of the things that I've noticed is that overt in-your-face mast cell disease, so like mastocytosis and mast cell activation disorder, tend to skew more towards diarrhea most frequently from what I've seen. Right. Now, your run-of-the-mill histamine intolerance, I get the occasional eczema, or I get the occasional sinus infection, like that sort of stuff is a little bit less clear. But the people who have confirmed cases of mast cell disease, I'm noticing a stronger predilection towards diarrhea in those individuals. So I think that there's something to it with like the mast cell activation and what they're spewing out when they degranulate, promoting more of a diarrhea pattern for a lot of people.
Yeah, I'm glad you brought that up. That's such a good catch. I think just clinically noticing that's probably about what I've seen. I don't think I've necessarily looked thoroughly or really thought closely about the presentation, diarrhea versus constipation and mast cells. But now that you're saying it, that's basically what I've seen too. But yeah, I think the inflammatory chemicals that are spewing out in something like a mast cell scenario is going to be where probably leans a little bit closer to diarrhea, just with the inflammatory response being involved. Yeah. Not to say that can't be at play in constipation, but I think it generally leans a little bit more on the diarrhea side.
I think there's something to be said too that with stuff like that, like, I have videos, for example, I have one video on my YouTube channel about how SIBO can cause weight gain. And then I have another video about how SIBO can cause weight loss. Right. And sometimes the dichotomy with stuff like this, like constipation versus diarrhea, weight gain versus weight loss, from the exact same condition, it could be a bit of a head scratcher for people. Right. And I think that it's like dysfunction or inflammation or impairment will highlight your kind of tendencies and your existing dysfunction. It'll highlight that. So like for one person, they could get stressed. Like actually, I spoke with an old friend recently from school. He was way overworking himself, like going through a very tough graduate school program, he's tried to start a business. He has 3 children at home. He's working, he's been killing himself.
Right.
And he had some really scary neurological symptoms pop up. And he was like, I thought I was dying for a couple of months.
Oh my God.
Like, I legitimately thought I was dying. He was having some POTS kind of issues. Like, I think some sort of movement disorder kind of stuff. Like losing muscle tone in his facial muscles, like all sorts of swirly stuff. And then he eventually got to the point where he realized that it was stress induced. And we were joking on the phone when I talked about it. I was like, you broke your brain with stress.
Right.
You broke your brain. And he even admitted, he was like, yeah, I think probably this was like kind of very quietly bubbling in the background, like from a genetic susceptibility or like a life susceptibility standpoint. And then when I was super duper stressed at the height of this graduate program, while having our 3rd child, while working, while starting a business, like when all the shit hit the fan,
right.
It allowed this thing to bubble up more. And similarly, like for me, I think, it's like I clearly had a celiac gene. Right? Like, you don't get celiac disease without a celiac gene. And then a number of things in my life, like antibiotic use, concussion, stress, whatever.
Drinking the creek water.
Yeah, drinking the creek water. Like, all of those things brought out that thing in me. But there's like 40% of the Caucasian population that has a celiac gene, and they never get celiac disease.
Right.
So it's like we all have tendencies and little quirky things that could pop up if we don't play our cards right. And then when we get inflamed or we have some sort of dysfunction, it's like that's going to show itself. So for some people, it's going to be more of an immune thing. For some people, it's going to be more neurological, like my friend. For me, when I've got weird stuff going on, it almost always starts in my gut. For other people, it might be skin, like eczema or psoriasis or something. So it's... Yeah, I forget what my initial point was in this. I think we were segueing off of mast cells somehow. But it's like, you can have people with the same diagnosis, the same root cause, who have different presentations. And it's like, their body, their genetics, their tendencies, their health history is going to be different enough that it might manifest in 2 different ways. So I'm sure there are mast cell patients who have constipation, but I tend to see them have diarrhea more frequently.
Right. I think you're accurate there. I also think too, with diarrhea, I know we were talking about like bile acid, malabsorption type diarrhea, which I know is fairly common. I think it's underdiagnosed a lot of the times, and there can be underlying issues at play like inflammation or IBD, or maybe you had your gallbladder removed or something that can sometimes cause it. But bile acid malabsorption is essentially, there's kind of different ideas on it. I don't know if you've kind of found that there's different thought processes on how the bile gets in the colon. Because there's like, the original thinking is that you're not reabsorbing the bile. Bile is naturally released in the small intestines to help you digest fat, but then by the end of the small intestines, that bile's supposed to be majority like reabsorbed. There should be very little bile going into the colon. So when you have bile,
I think like 95% or something like that.
Right. So when you have bile acid diarrhea, essentially there's way more bile in the colon, and it's leading to diarrhea. And I was reading something prior to this call where some scientists think it's a feedback loop issue, meaning that like some of the receptors in the small intestines are not sending the right signaling back to the gallbladder or whatever, and so there's more release of bile acids. And then again, there's also, and it could be a mixture of both. There might not be a right or wrong answer for this, but some people just might not be reabsorbing the bile. But I think that is certainly a factor for a number of clients I've worked with where they've had more of a bile acid presentation. So I think, again, a lot of what underlies that can be inflammation. Like, I almost think exploring the underlying factors for that. Inflammation of sorts, again, IBD is, like, probably a really common one. I think things like SIBO could do that. I think, again, gallbladder removal, where there's, like, less regulation of bile flow because now the liver's in charge of it, and the liver's just not as good at managing bile for us, can be a little bit, that can make it a little bit more problematic. But yeah, I think it can be a common one. Do you have any thoughts on bile acid malabsorption?
Yeah, and I'm working with a couple of cases with this right now. So I've kind of been like reading up on it a little bit more. So couplefold is, you're right. So there's this thought that your liver produces bile, and then it's concentrated in the gallbladder. And then when you need it, you get a nice hefty squirt of the concentrated stuff. And then that takes a ride down the small intestine, emulsifies your fat, helps you digest fat. And then the majority, like 95% of that bile, should be reabsorbed at the tail end of the ileum and make its way back up to be recycled so that your liver doesn't have to be producing as much bile on a day-to-day. There are receptors in the terminal ileum that seem to influence that or dictate that. It seems that there's, and I forget exactly if it's a consequence of Crohn's or if it's like an associated thing, but I remember reading somewhere that in Crohn's patients, there might be a lack of that receptor feedback that's appropriate.
Right.
So sometimes just looking to see if the person has Crohn's could be useful. But two things that I've read a bit about that seem to impact that. Stress chemistry is one. If I remember correctly, it was cortisol. It could have been corticotropin releasing hormone or some other stress chemical. But I remember reading a little bit about stress chemistry impacting that reabsorption in the terminal ileum, which makes a heck of a lot of sense.
Right.
The other thing that's more recent that's really surprising is blood sugar seems to be related. So there's a group of drugs, and hold on, let me just do a quick Google. Okay, I'm pretty sure they are GLP-1 receptor agonists, if I remember correctly. But there's these group of drugs that are being researched currently for type 2 diabetes and obesity, treating both of those conditions. And they do so by impacting GLP-1 receptors. It seems that there's been at least one study, there might have been two that I was able to find, where they used one of these GLP-1 receptor agonist drugs in somebody with bile acid malabsorption, and then their bile acid malabsorption problem went away.
Whoa.
Yeah,
That's
and it
wild.
starts to make you chew on this a little bit and think, okay, is balancing blood sugar the bigger thing that we need to be doing? Is that part of the mechanism of why that receptor and that pathway and that reabsorption is getting messed up? Again, this is very new. I think the studies that I saw on this were like 2019. So it's very fresh. And these drugs are still relatively new. They haven't been out for all that long, but it's really, really intriguing to kind of dive into that. And I need to do better for my YouTube followers, because I did a video about bile acid malabsorption and I mentioned this body of research. And I asked in the video, I said, if you guys want me to do a video on this GLP-1 kind of thing and explain it a little bit more, let me know in the comments. And a bunch of people said, yes, please do a video. And I haven't gotten around to doing it yet. So if you are one of the people who commented, I'm sorry. I do have that on the radar to do eventually on my YouTube channel, but I just hadn't gotten around to it yet. But it's deeply intriguing, especially when you think there are natural compounds that can impact GLP-1.
Right.
So it makes you start kind of wondering what we could do from like a nutrition perspective or an herbal perspective to help regulate that pathway so that your ileum can reabsorb your bile acids more efficiently.
So interesting. I think the stress piece is interesting too, because, and it makes sense, but we think about we've both had stress poops in our lifetime.
Yep.
And I feel like, some of the presentations of some of the clients I have, they have periods of really acute stress, and you'll see a lot more diarrhea in those situations. So that makes sense. I think, again, like with the bile acid presentation, there's sometimes more urgency. I also think there's a little bit more like needing to go to the bathroom in the night is another potential symptom to look out for compared to other presentations of diarrhea.
I would say also more discoloration.
Right, like green.
Like greenish or yellowish.
Right.
Like the color of bile.
Right.
Yeah.
Yeah. Those are things to keep an eye out on. And I think the nervous system stuff in general, too, is interesting. I know we talked about in the constipation side of things, dysautonomia and nervous system issues can lead to constipation predominant, but also I think the same thing could be said, like we were saying earlier, about the same thing could lead to different presentations in different people, and it's probably because there's multifactorial things at play.
Yeah.
But, if you're struggling with anxiety or struggling with brain-gut axis issues in some way, like, again, maybe you have the antivinculin antibody from a past food poisoning incident, maybe, again, you struggle with just a really stressful life that's affecting vagal tone, you certainly could have diarrhea as well from just the stress of it all. Absolutely. And again, it's interesting you bring up the bile acid malabsorption piece potentially being, like, the feedback loop being hijacked by cortisol in some way.
Yeah. Yeah, and I think it's worth pointing out briefly, too, that I think your body is smarter than you will ever understand. And I really think that the body has a way of knowing on some level when it's safe to collapse. And it's relatively safe to be symptomatic versus needing to push through an acutely stressful thing. So, for example, in the constipation episode, I revealed that historically, most of my life I've struggled with constipation. But when I was in college and I was a rower, I would have the nervous poops and I would have to run off and have diarrhea before every herb test. And I feel like that's an example where, like, my body knew, like, okay, it's relatively safe for me to go have a quick urgent poop. But, like, if I was, running away from a mugger or, I don't know, like a chainsaw murderer, axe murderer, I feel like I wouldn't poop my pants in that moment, but I would probably poop a lot after I got away. You know what I mean? Right. And, like, I've seen this with my own health. But do we know,
have you been chased? Maybe.
I have not been chased by an axe murderer with a chainsaw. So maybe that's why I don't know. But, it's like, but also, like, if you think, and like, trigger warning perhaps for people, but if you think, I feel like the stories and the narrative I've heard around sexual assault, like, that's something super, super traumatic. I feel like I have yet to hear a story where somebody was physically, like, sexually assaulted and they had, like, diarrhea right there on the spot while they were being assaulted.
Right.
Like, I think that the body kind of has some general awareness. It might not be...
I think you're right. I think you're dead on.
Yeah, and I'll share something that's not in any way, shape, or form as severe as what I just talked about. But did I ever tell you about the grand pink eye of, it was probably 2010?
Oh, no.
Okay.
No, I've not heard about this.
Okay. So it's going to have a point, I swear. Just stick with me for a minute. So in chiropractic school, we have the national board exam, but it's broken up into 4 chunks. So you take part 1 when you're about a year into school, and then you take part 2, 3 you take together, and then part 4 you take later on. And each of these is throughout school, though. Like part 4 you take when you're about to graduate, basically. Well, getting ready for part 1, that's like the most academic of them. Like just like a lot of, how much do you remember from biochemistry? How many things do you remember from anatomy? It's a lot more just like book learning. And it was the first one we had taken. All of us were stressed out from it. And I'm a pretty good test taker, so I wasn't like terrified of it, but I was definitely more stressed than I normally would be. And it's a 6-part exam. So you take part 1, you have a break, you take part 2, and you keep going back and forth. Well, toward the end of the 5th part of this exam, my eye started to itch a lot. And I had this awareness. I was like, I should probably run home and take my contacts out. But they had this rule where like they were supposed to keep us in the room for the full hour because everybody across the country was taking the exact same test at the exact same time. And it's like part of the protocol is like, nope, you stay in the room for an hour. But I was done early. I was like, God, this eye is really itching. And I raised my hand and I was like, look, I'm so sorry. I know you're not supposed to do this, but like, can I leave a little bit early? Because if I leave right now, I have enough time. I can go home, take the contacts out, get my glasses and come back in time and I'll make it for the last exam. And they let me go. And I was like, on the way to the car, I was like, that lady was so nice. She didn't have to do that. I know she could get in trouble for doing that, but that was really cool of her to let me go and run back and get my glasses. And then I pulled down my visor in the car and I looked at my eyeball and I was like, oh God, it was gross. That's why she let me go, because she could see visibly that my eyeball was infected. I was like, oh God. So I go home. Luckily, I was very close by. I went home, took out the contacts, threw it away, put on my glasses, went back to my last exam. And then throughout the exam, my other eye started to itch. And I was like, oh God. And I was not, touching them. By the end of that 6th exam, I had double pink eye. Like full-blown pus, red, itchy, swollen, nasty pink eye in both eyeballs. It was like collapsing over the finish line.
Oh my gosh.
And my body just knew, like, okay, now it's safe to collapse. It wasn't ideal, but my body did limp all the way through that 6-part exam, and I collapsed over the finish line. And it was just so funny because all of my schoolmates were like, let's go drink, and they wanted to go to bars. And I told my friends, I was like, I'm going to go home. I'm going to get Ben & Jerry's, and I'm going to watch Mulan in my pajamas. You're welcome to join me if you want, or you can go to the bars.
Gosh.
And a couple of my friends, to their credit, came and just crashed with me, and we watched Mulan and ate Ben & Jerry's that evening. But yeah, I got double pink eye. But I think, similarly, one of the patients that I'm working with bile acid malabsorption, we've talked about this quite a bit, that she has recurrent profound stress in her life, and there's not really a lot we can do to get around that at the moment. But she's noticed that like the day that she has a stressful thing, she's usually pretty okay. But it's like the day or 2 or 3 after that, she'll oftentimes have a flare. And we've talked about this, how like, I think your body knows that you need to get through that thing on that day, and that it's safer for you to be symptomatic and collapse and burst into flames after the fact. So don't, the pattern with stress and diarrhea in particular can be really weird to parse out, because our logical brain thinks, oh, if I'm stressed on Tuesday, then I must have diarrhea on Tuesday. Right. And if it's not that pattern, then it must not be stressed. And I would encourage you to see outside of that understanding of it and look to the days surrounding the stressful event.
Yeah, it's a good point. I also, one other sort of area to ruminate on a bit is, we talked about movement in the last constipation episode, but I think over-exercise tends to be more diarrhea-inducing, and I think it has to do a little bit more with some of the inflammation that can happen if you're doing really high intensity exercise. for longer periods of time. Like I'm thinking like endurance, exercising, sometimes CrossFit, it sort of falls into this like higher intensity. Marathons. And it's like when you have so much oxygen and resources leaving the gut for a longer span of time, it can lead to more inflammation in the small intestines and beyond in the gut. It tends to cause, like, the gut doesn't like being super hot, so there's kind of a heat that happens when you exercise that the gut doesn't really like, that it inflames it a bit. And then also just the lack of oxygen to the gut creates problems. But they even have a term for it in the running community, the runner's trots, which is like runners that get diarrhea. It's like super, super common. I ran cross country, and it's not even that we were running like tons of mileage, but like if you're putting your body under like incredible stress physically, it can be problematic. And I think certain individuals can adapt to it better than others. Yeah. And again, there is an adaptation that happens, but sometimes too, if you're going from like zero exercise and then you're doing an intense boot camp program starting in the new year, and your body isn't used to any of the stuff that's going on gut-wise when you're exercising, that's when you can run into a little bit of problem. So if you notice too that, like if you do more high-intensity stuff, or if you're someone that's like a high-intensity exerciser, it can be a little bit tricky, but even reducing the intensity a little bit or reducing mileage and seeing how your gut feels. I mean, I have some runners that I've worked with where cutting back on mileage has done wonders for them, and sometimes they can even increase again later, but it's really hard for them to get control of their gut symptoms while they're doing like heavy mileage at a particular point in their journey.
Yeah. And I would throw out there two other pieces with regard to exercise. Disordered eating and undereating. More common amongst athletes, I would wager. Especially like I'm picturing, like figure posing is notorious for this. And like bodybuilding kind of sports are notorious for this. Like I knew a woman, she's a little bit older than me, but I knew a woman, I went to high school with her, we're Facebook friends. She did figure posing for a couple of years, and she literally was like, oh, I ate nothing but chicken and broccoli for months and months and months. And I was weightlifting like a crazy person. And like she looked ripped. Like she was nothing but pure muscle. But like how much abuse can the body take before it gives? Right? So like I think that the disordered eating and under-eating thing is going to be more prevalent in extreme athletic circles. I would also say there are a lot of people who use exercise as an escape from their stress. And then it's almost like if you're super stressed because you're in an unhappy marriage or an unhappy relationship, or you're overworking yourself, or you hate your job, or you hate your life, you hate your whatever, if you are that stressed that then you use exercise as a coping mechanism, and you're literally running away from your stress every day when you run, it might also be mixed in with the stress chemistry piece of it, of like, maybe the ultimate thing you need to do is like be a little bit more moderate on your exercise and look at the stress and the mental health part of what's going on, and like maybe marry the two of those together, because I think an awful lot of people use stress as an escape from they use exercise as an escape from their stress, particularly in like, marathon, triathlon, like those really intense kind of athletes, I think do that more frequently.
Well, I'm so glad that you brought that up. It's definitely a discussion I have with clients who I feel like are falling into that mentality. And a lot of times I'm like, okay, I understand that that's a stress reliever for you, but like, why can't we find something that's more still? Like, so I almost present it in that way, but it also brings up, like, my dad in particular was a marathon runner. I don't think I love my dad. I think both my parents have work to do in terms of like stress management. But, you know, he always felt like, oh, I like wasn't regulated unless I ran, or I have to run. But every like run or bike ride that you would go on with him was always like freaking intense, like the most intense
500%.
Right. It's like, and my mom at this point is so funny. She'll be like, I'm like riding with your dad, but like he never wants to just like mosey or like do like a gentle ride. Like it's always so intense. It's hard to keep up with him, blah, blah, blah. But it's like that was the mentality. I feel like it's an interesting scenario when, and that's kind of how I grew up too. Like I always associated exercise with like intensity, purpose. You're gonna like run as fast as you can, and I that
go big or go home.
Right, and that bit me in the butt. In more ways than one. I think that over-exercising was definitely a part of my presentation. And again, running my body more into the ground. Because I think exercise is really restorative, but there has to be enough rest in order for you to reap the benefits. And a lot of people are not getting enough rest and maybe not getting enough nutrition. And they have other stressors. So there has to be a balance of stressors in your life, and exercise is inherently a stressor, but we can adapt to that stress to where we're more resilient. But it is interesting, I think, coming from like my dad ran 3 or 4 Boston marathons, just like an intense runner, how that mindset, I don't know, it definitely didn't serve me well, I would say, to be hyper intense runner. It created some problems for me, but yeah, I'm glad you brought that up.
You tell your mom that when I visit you in Cincinnati, I would be more than willing to take a mosey-paced bike ride with her, and we could stop and smell the flowers, we could stop and take some selfies. That is my choice of... I prefer the leisurely activity version of biking rather than the ultra intense. And depending, if I'm feeling up for it, maybe I'll go a little bit faster in the moment. Right. But yeah, I think it's interesting how that kind of stuff gets imprinted from our parents. Like we observe their behavior and their coping mechanisms or lack thereof.
Right.
And our teammates and our coaches too. Like for anybody who was an athlete, I remember straight up, and sometimes it's glorified. I remember at one point, so I did really well in rowing my freshman year of college, and then I had the drinking of the creek water incident. If you don't know that story, go back to episode 1, folks. And I got a heck of a concussion and I whacked my head. And in the months following that, my athletic performance took a nosedive. And I never got back to being quite as good as I was freshman year, not consistently at least, despite training more and being in better and better shape and having more years of coaching under my belt. I never got back to that point. And I remember at one point, one of my coaches was so frustrated with me because I don't know, I think they didn't get it. They thought I was being a bum or something.
Right.
And my coaches in college motivated much more along the lines of beating your mental health into a pulp in hopes of motivating you.
Right.
And I remember at one point, I forget the exact scenario, but something kind of shitty happened. And one of the coaches kind of treated me like crap in front of the rest of the team in some way. I don't remember exactly. And I went to talk to him afterwards about it. And he was like, I just hope that one day you take out your rage on the erg and you just sit down on the erg and you rip some crazy, sub 7-minute 2K, which would be Olympic level, by the way.
Right.
But he was like, I just hope that one day you tap into your potential and tap into your rage and you just rip some crazy erg score and show us what you're capable of. And I'm like, you're an idiot. It's
right.
If you've met me for 5 minutes, you know that that's not how I work. Like,
Right.
if you beat me into the ground, I'm just going to curl up in a ball and shrivel up. I don't motivate that way.
Right.
But, like, the idea that you could, like, beat somebody up mentally for months or years, and then one day they're like, I'll show you, and they just get on the erg. Like, it's so preposterous to me. But it's almost like it's glorified, right? When he was saying, like, I hope you, like, get on that erg and, like, show us what
Right.
you're made of. Like, he was kind of glorifying this, like, picture of a person who has some mental health issues and, like, is deeply traumatized or upset or full of rage, and then they take that rage out physically on the rowing machine. Like, he was glorifying that, like, it would be this
Right.
great thing, and it's like, yeah, that can be an outlet, and I you know, it's better that than hitting a couple of wine bottles and getting shit-faced drunk. But, like, is that the healthiest way to deal with the mental health repercussions of, like, somebody being emotionally abusive to you for years of your life? Like, no, maybe there's better ways of working through that rather than just taking out your physical aggression on an inanimate object and then getting, like, a really good erg score out of it. So
Well,
sometimes that behavior is glorified.
it really is. It's funny. I'll never forget. I think my brother, I think I was really upset after a basketball game or something. I was crying or something. I played bad. I don't know what it was, but my brother was like, girls are so funny. Like, girls, not saying it in a bad way, because he was kind of pointing fault at guys too, but he's like, girls will, like, cry and kind of beat themselves up. He's like, guys will just punch a wall and watch their fists bleed, like, until they get over it. And it's like, it's sort of what you're mentioning. It's like, there's raginess, and it's like, kind of not necessarily the right way of thinking either. Like, I think both have their issues, like, where I think in general women probably internalize things more, and men sort of take it out on things more.
Yeah.
But
skull cap.
right. It was,
go back to Nervine Part
yes.
2 episode, people.
Exactly, but
yeah,
but I think good.
Oh, I was just gonna wrap up with a bit of context. That coach, not all that much older than we were at the time. Like, he's maybe 5-6 years older than my group was. And he used to tell us the story that when he was a rower in college, he had a bad erg score or something happened, and he punched a hole in the wall. And it was like a point of pride. Like, I punched a hole in the erg room at the such and such university erg room, and, like, and it was like, okay, I can see that you're impressed with yourself for this, but, like, I think you need therapy.
Right.
Like, that's an abnormal thing. Because, like, what if the wall wasn't there? Would you punch somebody in the face? Like, where do you draw the line, you know?
Right.
So I don't know. I think that that's more for another mental health related episode, perhaps. But yeah, I think the athlete exercise is a double-edged sword. It can be wonderful and health promoting, and doing zero exercise is not a good thing.
Right.
But overdoing it, or, like, the relationship you have between exercise and mental health, is really important to analyze as well.
Yeah. For sure.
Yeah.
For sure.
Okay. Well, let's think. So we touched on microbial causes of diarrhea, which, again, we have entire episodes on hydrogen SIBO, hydrogen sulfide SIBO, whole episode on parasites, so that you could take a deep dive if you guys want to. Bile acid malabsorption, we talked quite a bit about. May I take us on a little bit of a tangent of a topic, and then if you have any other causes of diarrhea that you would like to discuss, we can certainly do that. So, like I did with the constipation episode, I just pulled up a really brief snippet of traditional Chinese medicine, TCM, diagnoses that could be relevant for diarrhea. My caveat, my little shtick first, is that I am not an acupuncturist. I am not trained in traditional Chinese medicine. I'm fascinated by it, and I have a very basic, rudimentary understanding of it. But that being said, there's a couple of patterns that similarly might be worth thinking about, and maybe Chinese herbs or acupuncture or both would be useful for some of our listeners. So in this article that I found, with my stellar Googling skills, I will add, This person said that there are 6 basic patterns in TCM that would cause diarrhea. So they said the first 3 types of diarrhea are often acute, meaning short-lived, causing a sudden onset, which will also include other symptoms depending on the cause. A cold, damp pattern of diarrhea will be accompanied by abdominal pain, fever, aversion to cold, stuffy nose, headache, and general aches and pains. Damp heat, which my understanding is that that's like a progression from the first one. I think you might start as cold damp and then move into damp heat if it gets trapped. Again, I'm not trained in this, people. Damp heat pattern diarrhea will be accompanied by abdominal pain, urgency, burning sensation with the bowel movements, irritability, and thirst. The third acute pattern is called retention of food. This is common when people have eaten poorly or have eaten far too much undigestible food or poor quality food. This causes diarrhea with abdominal pain, rumbling digestive sounds, fullness in the abdomen, burping, acid reflux, and loss of appetite. I think that last one sounds quite a bit more like a lot of the IBS that we tend to see with like that abdominal pain, GERD, indigestion-y kind of profile.
Yeah.
And when I hear retention of food, it makes me kind of conjure up an image of what TCM practitioners would call stagnation. Like the food is stagnant and it's not moving through, which makes me kind of wonder if like digestive enzyme inefficiency or like low HCl or low bile, like one of those things could be involved perhaps. Then chronic diarrhea is the other 3 patterns. Liver and spleen dysfunction. Now, I'll point out, the name of the chi in TCM doesn't always perfectly correlate with the organ that we think about in Western medicine. So if you hear spleen chi, think more stomach in Western medicine, for example. Liver, I would say, loosely correlates with the Western anatomical organ, the liver. But if you hear spleen, think stomach for like symptom-wise. But liver and spleen dysfunction pattern diarrhea will be accompanied by distension and congestion in the chest and rib cage, burping, poor appetite, abdominal pain, diarrhea brought on by depressive moods, and frequent irritability or angry moods. Deficiency of spleen and stomach pattern diarrhea is accompanied by chronic loose stools, frequent bowel movements after eating heavy, oily or greasy foods, loss of appetite, bloating after eating, and fatigue after eating throughout the day. Again, that one seems pretty on par with a lot of our patients as well. And then lastly, kidney and spleen deficiency pattern is due to a lack of yang, or warming energy. The yang energy is what supplies the warmth and the ability to cook the food in our stomach, as well as transform it into something useful in the body. You could think of it as like digestive gusto or digestive fire. When this function is impaired due to deficiency, there is early morning diarrhea, a cold sensation in the abdomen with pain and rumbling just before a bowel movement, a feeling of always being physically cold, and a sore low back and knees. So, food for thought. This is just one article from the bowels of the internet. But if any of those patterns sounded familiar, like, oh, dang, like they even knew about the low back and the knee pain, darn it.
Right.
You might want to try out acupuncture. It can help with a surprising amount of things. I can't wrap my head around how acupuncture works entirely, but I can tell you it works.
Right.
So those are just a couple of the patterns that seem to pop up in TCM that can cause diarrhea.
Cool. Yeah, I think the only other thing to maybe talk a little bit about is like, in the same way low fiber could cause constipation, low fiber could also cause diarrhea. From a dietary standpoint. I also think sometimes diarrhea can be it can be indicative of intolerance too. Whether it's like a lactose intolerance or like a gluten intolerance of some sort, or some inability to kind of break down some particular food. That could be something to explore. I feel like that's more associated with diarrhea than constipation, typically. But that's kind of, I would say, the main things I think about diet-wise.
Yeah, I think so too. I think that, the fiber piece of it harkens back to feeding the good microbes and how important they are at regulating inflammation and like the gut lining integrity. And especially with insoluble fiber, kind of like bulking up and fluffing up the stools. Like you might not have any bulk to the stools because there's no bulk in the stool. Like it might be because of a lack of fiber. So yeah, I think that that's a valid point to bring up for two reasons.
Right. I think sometimes with diarrhea too, like anything that and this is sort of a expansion on what we were talking about with inflammation. Probably like with histamine, doing things that reduce or that stabilize mast cells would help with diarrhea if that was part of the equation. I think in the same vein, like doing things that could potentially help with inflammation can help with diarrhea. So I think things like butyrate or SBI or colostrum or again like vitamin A, vitamin D, like some of these things that kind of help inflammation at the gut lining could potentially help with diarrhea. I generally think that colostrum and SBI seem a little bit more helpful for diarrhea from what I've seen with clients. But yeah, I just wanted to throw that out there. Like anything that kind of helps with inflammation probably would help a bit with with diarrhea, sorry.
Yeah. Yeah, I think that's a good point. And I will throw out there that inflammation is a tricky beast. Maybe that needs to be our next episode, actually. Yeah. When we talk about inflammation, it's this big, broad creature. And there's a lot of people who will be tested for inflammation, quote unquote, and their doctor might run a test like C-reactive protein or maybe homocysteine, and it'll come back normal, and the well-intended doctor or nutritionist or whoever will get that result back and go, you don't have any inflammation, you're good. And
Congrats.
The person kind of blinks and is like, meanwhile, I have like fibro and IBS and rheumatoid arthritis, and like function. I have all of this. Yeah, like I have all these things. Clearly, I'm inflamed. And it's important to know that there's a lot of flavors of inflammation.
Right.
And a lot of them are difficult to pick up on in blood work because there are compartments of the body, right? So like if we sample the fluid and the cytokines and the chemicals from your liver, that's going to look different than if we sampled the fluids and the chemicals and the cytokines from your knee versus, your glute muscle versus your eyeball versus whatever. So somebody can be very, very inflamed in one tissue and it won't show up in the blood, or it might not show up in another tissue, but we are at the mercy of doing the majority of our testing through blood work and occasionally stool or saliva or urine. But like each of those things is a compartment of the body. Blood is one compartment, one tissue of the body. What's coming out in stool, like that's another compartment. Urine is kind of another compartment. Saliva. Mm-hmm. So like if you get a negative test for inflammation, that doesn't get you off the hook for inflammation. It just means that it wasn't the flavor or it wasn't in the location that you were able to see it on that particular test. But I think that just inflammation and its ability to impair the gut lining and motility and the gut-brain axis and digestive enzyme output, like that, it's very much on the table for anybody with diarrhea or constipation, I would argue.
Right.
Yeah.
100%.
Yeah.
We should do an inflammation episode.
We should.
Add that to the listy list.
Add it to the list. Done deal. Well, guys, speaking of which, if you guys have suggestions for topics that we should cover on this podcast, by all means, reach out. We haven't looked at the IBS Freedom Podcast email accounts in quite some time, so I would highly recommend not emailing us.
Right. Who's managing that account? We don't know.
Nobody. I think it's like we set it up, and then like both of us are just so busy that we're like, we'll get to it later.
It was a good idea and thought.
It is. Maybe someday we will man it a little bit more intentionally, but right now it's kind of a weird archive. But if you have a suggestion for a topic that you would love us to cover, just message one or the other of us on Instagram and get it to us that way, or maybe comment on the YouTube video down below and we'll see those probably. Amy, your Instagram handle is?
Amy_RD. Amy _ Hollenkamp _RD. Sorry, I'm jumping ahead.
I was quite confused because I was like, wait, did you update your Instagram account? Yes, so Amy _Hollenkamp _RD, and I'm Triangle Guts, all one word. But holler at us on Instagram if you have a topic that you would like to suggest. Otherwise, we will see you in the next episode of the IBS Freedom Podcast, and we will see what revelations and what stories we have to share with you next week. Thank you all for tuning in. You know the drill. If you're on YouTube, click like, subscribe, comment, all the things. And if you're on Apple Podcast, if you could leave us a 5-star review, that would be so deeply appreciated. And we love each and every one of you, and we will see you in the next episode of the IBS Freedom Podcast. Take care.